Thanks very much, Valen. All right, let's move into those headlines now. The National Institute for Communicable Diseases says almost 9,000 people are now being treated in hospitals across the country after another 940 people were admitted to hospitals. 13,246 new COVID-19 cases have been identified in just the last 24 hours, representing the highest number of daily cases recorded since January, with a positivity rate now standing at 21.7%. Another 136 people have succumbed to the virus, bringing the total number of deaths to 58,223. Now, more than half of these new cases, or 7,859, were recorded in Gauteng. Active cases has increased to over 95,000. Black Business Council President Sandile Zungu has described the late former Eskom and Telkom board chairman Jabu Mabuza as a committed patriot. Mabuza died yesterday from COVID-19 complications in the Milpark Hospital in Johannesburg. He was 63 years old. The former taxi boss chaired the board of the troubled Eskom from 2018, where he also acted as CEO. The Chief Inspector of Mines, David Msiza, says closed-down mine shafts should be filled with rubble, this in an effort to stop illegal mining. Msiza accompanied Minister of Mineral Resources, Gwede Mantashe, on his visit to Orkney in the northwest yesterday. This comes after the burnt bodies of 20 illegal miners were discovered near 2 ventilation shafts on Tuesday. Msiza says they are going to make sure that these sites and such sites are closed down completely. And that's the end of our news headline bulletin. Details of those stories and more coming up at 7 o'clock. Right, in a short while, we're going to be joined by the health MECs from both KwaZulu-Natal and from the Western Cape. So do stay tuned, talking to us about the situations that the different provinces are facing when it comes to COVID-19. So stay tuned for that conversation. Although, as you can see in the news, Gauteng really the center of the storm, and certainly an uncharted territory for the province when it comes to this very, very big spike when it's come to the third wave of infections. So we'll be sure to talk about that as well. All right, let's take a break. We'll see you after this with some weather as well as that interview. Stay tuned.